Dr. Henry, what can you tell us about an alleged COVID-19 outbreak on a Vancouver television set? We're hearing as many as 17 people have tested positive, and also my understanding is that they have their own private teams to do testing. Just wondering if there's any insight into that.
I am not aware of that, not aware of an outbreak on any of our sets. I know there has been private testing being done, but I haven't been informed of that.
Next question is from Graham Wood, Glacier Media.
Well, hi, Dr. Henry. On the Vancouver Coastal Health website, it says you may need to self-isolate if a child in your household tests positive for the virus. Under what circumstance would I not need to self-isolate for 14 days if my kid has COVID?
It depends a little bit about the age of your child, where they were exposed, where the exposure event was, and what interaction you have had with the child since they were in their infectious period. So most parents, of course, will be close contacts with a child. Many parents may have had contact with the same person or the same exposure event as the child, and if you are past your infectious period, you would no longer need to self-isolate. So it is a little bit of a depending on the situation, depending on the age, depending on who's been exposed to whom. But for a young child in particular, it's very likely that at least one of the parents will have had a close contact and will need to be isolated as well.
Graham, do you have a follow-up?
Sure. In Denmark, they do testing for any close contact. They do two tests. Here we don't do any tests. We put people in self-isolation for 14 days. But in other jurisdictions, particularly in Europe, you can get testing done and clear yourself. On Tuesday, you talked about how that may not necessarily put you in the all clear, but is there not a sort of way that you weigh testing and letting people get back into the economy and their households versus not testing?
Yeah, so it is a challenging thing because we know the incubation period. So after I've been exposed, it can be up to 14 days to develop symptoms. We know that most people develop symptoms around day 5 to day 7, but some people, and a proportion of them, are highly infectious to others up to day 14. So that is our period that we use for safety, for isolating people. And I know some people are experimenting now. We have not yet seen the results of how people are doing that, and it's a matter of managing the risk. So yes, some countries have said that we'll test somebody at day 10, and if they're negative, they can skip the last 4 days of the incubation period. We have not gone that way yet for a variety of reasons. We still are at the phase where it's important for us to try and reduce the risk of transmission from every single case. So those are things that we are looking at, both nationally and looking at what's happening around the world to see if there's ways of using testing to help facilitate. But you always run the risk then of somebody developing symptoms and being infectious to others in that last part of the incubation period.
Lee Wilson, APTN.
Hello, Dr. Henry. A coalition of 20-plus First Nations are calling for more transparency on COVID-19 from the province. They're asking for proximate case information in relation to their communities. Does the province have a response to that?
Well, I don't speak for the province, but I will say that we have been meeting regularly with the coastal First Nations around these very legitimate concerns that they have, and absolutely acknowledge that they are doing their best and what they believe is important to protect their communities. And we know that they know best how to protect their communities. I will also say that we have that in common, that both of us want to do everything we can to ensure that First Nations communities in BC are protected as best they possibly can, and we are working together with them to ensure that they have the information that they need to do that.
Do you have a follow-up, Lee?
In the next one they talked about community-led contact tracing. They wanted to have basically somebody from the community assist with the contact tracing. Is that something that's possible?
Absolutely, and I think that's a really important measure to help us work together. And we know that sometimes, and we've seen this in a number of community outbreaks over the past few months in different areas of the province, that when our Western public health ideas connect with communities that are dealing with COVID-19, that sometimes we can have challenges in working together. And this is a really important piece where we can work with community members who are trained and who have some understanding of how to best do culturally safe contact tracing, and can work as a partner with us in helping the community manage outbreaks and cases when they happen in communities. So this is something we're very strongly supportive of, and we're working together with nations to make that happen even as we speak.